Hi, welcome back on Iron's Health Talk with Dr. Akram. Today we are talking about arthritis, which is an important condition. 60% of the population at some point will hit arthritis. So far we have talked a little bit about arthritis, different kinds of arthritis, and its relation to diet, especially the osteoarthritis. And our special guest on program is Dr. Farid from Pool. Farid, welcome back.
Hi Akram, thank you very much for having me back.
Okay, cool. Okay, let's talk a little bit. Anyway, this is a live program. You could see our number on the television. You could pick up your phone and call us if you have any questions or you want to tell us anything about it, or if you want to request anything. Otherwise, you can always follow us on our Twitter and Facebook page. Okay, let's go back to the subject. What's the difference between aging-related changes in cartilages and osteoarthritis for you?
So, Akram, these are slightly two different conditions. We all know that with the passage of time, the cartilage within the joint that will wear off. But it does not mean that all of us will have arthritis. So, the arthritis, as we discussed, is a different condition. In aging, the cartilage, it becomes the water content within the cartilage, they become less with the passage of time. But in the arthritis, the water content increases. And when the water content in your cartilage within the joint increases, it means the cartilage will become softer. And when the cartilage becomes soft, who is meant to be weight-bearing cartilage end up non-weight-bearing cartilage, which means it will become soft and it will not be able to bear the weight of that person, which means it will become, gradually it will become thin and then lead to permanent changes within the knee. So yes, we will have some kind of changes with the passage of time, with the age, but it does not mean that all of those patients will need any knee replacement. So arthritis can happen in any age group. It can start.
Farid, I'm going to hold you there. There is a caller coming. Let's join the caller to our program. Hello.
Yeah.
Hello.
Hello. Assalamu alaikum, sir. Bala Asani.
Wa alaikum assalam, sir. What is your name?
Shafiq from Burnley. Shafiqul Alam.
Shafiq, where are you calling from?
Burnley, sir.
Okay, excellent.
Lancashire.
Oh, Lancashire. That's amazing. Good place. Shafiq.
প্রশ্ন হলো স্যার ভেরি ইজি কোয়েশ্চন আমি আসলে জানি না 2003 থেকে আমি হজ থেকে আওয়ার পরে ওয়াইচেপল রয়্যাল লন্ডন হসপিটাল অ্যাম্বুলেন্সও দেখছি যে মার্কটা কি একটা স্নেক থাকে না একটা মার্ক থাকে একটা মার্ক থাকে স্নেক থাকে ও মার্কটা ওনে আমি দেখি করোনা ভাইরাস আইছে পর্যন্ত বিশ্ব স্বাস্থ্য সংস্থা এটা যদি বিশ্ব স্বাস্থ্য সংস্থা
Okay, sir, our studio will translate your question because unfortunately I don't understand Bangla and Farid also, but we will get it translated and we will come back to you with the answer. Until then, you can be online or you can keep watching our program, and until we get the answer, I'm going to let Farid talk about what we're talking about.
Yeah, so as we were discussing before that our osteoarthritis can happen in any age. So it's that age-related changes within the knee are different than the osteoarthritis. The youngest person I've done a hip replacement was like 32-year-old female. So they can be related to the dysplastic condition you are born with, like patients who are born with dysplastic hips. So they have early onset of osteoarthritis in their hip, and that can lead to permanent changes. So yes, they are different conditions, and sometimes the age-related changes can be bad enough if you are obese or you have different kind of a trauma to your knees or hips. Then yes, they can lead to the severe symptoms to that extent.
Farid, 1 second. Let's join this call. I think probably he didn't understand that he talked to us in English, and we'll give him a chance to talk in English. Hello, sir. Welcome back.
Yes, sir. Yeah. And firstly, I seen it in 2003 in the Britain, in the NHS mark is a one snake, the ambulance. If you see in the ambulance, the mark on it. And that I follow this today in the present time is a world NHS same mark. So I mean that why not whole world come together, one NHS. Like if I am living in Britain, I have a GP in Britain. When I go to my back home, my Bangladesh, their GP is well same GP. They connection with each other. That is good for in the present generation in this year tested coronavirus. Each other GP contact each other. Then nobody problem is. We need it because of poor. We need it. Poor come to lead. We need it food, sir. God messenger, Jesus Christ, present in this year, sir. I'm fed up with the politics, sir. Thank you, sir.
Thank you very much, sir. Thank you. We understand your concern. Unfortunately, we won't be able to answer that much into it because we're talking about arthritis today. And anyway, thank you very much. We understand your concern. Farid, yeah. Thank you very much. We'll see you in some other program. Farid, let's go back to the program.
Yes, so as we were discussing that there are different conditions. It does not mean that all the aging population will need knee replacement or hip replacement at some stage, but yes, if they come to that stage that their symptoms are bad enough, then yes, they will end up having a replacement surgery at this stage.
Okay, let's talk about, are there any treatments for osteoarthritis?
Well, yeah, that's a good question, Akram. To be honest, there is no cure to this condition. But
There's no cure.
There's no cure. Once it happens, then you have certain choices to choose from. One of them is to live with it. The other one is to change your lifestyle. Changing the lifestyle means, and that is the most effective, I would say, strategy to relieve your symptoms before going ahead for surgery. So changing lifestyle means reducing your weight.
Reducing your weight.
That is the most important thing. There have been studies which has been done, and if you imagine that if you have 1 kg weight carrying in your hand and walking, then your knees will bear about 4 kg weight.
So if you carry 1 kilo of weight in your hand and the knees bear 4 kilos of weight,
it
so
means
it's 4 times
four times to your body weight.
Body weight, yeah.
Go to your knees.
So if you are 50 kilos, your knees bears 200 kilos.
Exactly. So that is the most important thing, most important intervention which you can do to improve your symptoms. And the studies have been done which shows that reducing about 10% of your body weight will relieve about 67% of your symptoms, which is a massive difference. So we have seen in our practice as well that people who come in for hip or knee replacement, and if they are overweight or obese, then first thing we advise.
Farid, I'm going to join another caller. Sorry to interrupt you at this time. Hello. Hello. We can hear you. Hello. Caller's gone. Sorry, Farid. We'll go back.
It's okay. So weight reduction is the most important thing which people can do, and if they can take one thing from this program today, then that would be that keep your weight under control.
Under control.
Because that is the most important thing to relieve your symptoms and to prevent your replacement surgery. So yes, there's about 67% improvement with about 10% decrease in your weight. And it affects your ankle, your hips, your knees, and you will see significant improvement. The other thing which you can do in terms of lifestyle modification when we are talking about is cycling. It's called
cycling. Wow.
So cycling, as you know, is already in the fashion these days. If you can't go on a mountain bike on the road, then you can buy a static cycle. What you need to do is you need to do non-weight bearing exercises, and there are two exercises which are very good. One of them is static cycling or swimming.
Swimming.
If you don't have any access to the swimming pool, then I would advise that you have a static cycle at home and do 30 minutes of cycling every day, and you can see significant improvement in your symptoms. Either is a hip or knee arthritis, you will see significant improvement.
That's a very good advice, Farid. In these days, there is a lot of cycles you could buy, and this static cycle especially. Even ladies at home, they could just sit down and while they're watching their favorite television show or while they're listening to our Iron Health Talk, they can cycle for half an hour and they get the benefit out of it.
Yeah, in Bournemouth, we have a very good Professor Middleton in here, who is an expert in the hip surgery, and they have organized a study called CHAIN, which is called Cycling Against Hip Pain, and that chain was funded by Bournemouth University, and then later on they have proven that there were a significant improvement in patient symptoms who were over 65. And they had established arthritis in their hip, and they were a candidate of hip replacement, but they were given the option of going to the CHAIN program. Once after having a regular session under the physiotherapist with the static cycle, they have improved significantly, and about 35% of them never needed to go for the hip replacement. So it's quite a
is people who went for the surgery, they've been given the option either to go for surgery or they've given some time so they could do the cycling and other activities. They came back and 30% of them did not need surgery. That's quite...
Yeah, but over 35% of them, their symptoms improved to that extent that they do not need operation.
That's really important, isn't it? It's really important thing. A cycle doesn't cost in these days too much. You can even buy second-hand bicycles on Facebook.
I think it is really important for people to understand that how important it is to have a daily routine of non-weight bearing exercise. So weight bearing, once you have the established arthritis in your knee or hip, then the weight bearing like long walks and running is not good for you. It is the impact that can cause further damage. So at that stage, what you need to do is you need to reduce your weight so that less forces are going through your joints. And the other thing you need to do, you need to keep the movement in your joint so that the fluid that is there that goes through the cartilage, and that helps in the regeneration of the cartilage, and your symptoms improve because you keep on moving. So your symptoms of early morning stiffness and your pain that get better. And with the cycling, is the muscle around your hip or knee, they develop as well. And when the muscle becomes strong, then of course you will relieve some of your symptoms from that.
That's really important. It's not only good for arthritis, it's good for all your health conditions, isn't it?
Yes,
your hypertension, your heart disease, and we were talking about stroke, and it's really good for everything. So it's half an hour exercise. I think that's what we suggest most of the time now, isn't it? Are there any medical treatment? What can you...
So symptomatic relief from the symptom, you can take paracetamol, you can take non-steroid anti-inflammatories that can be taken orally or that can be applied locally around the hip or knee area. You can take there's some evidence of interarticular steroid
injection. I was about to ask about.
Yeah. So the steroids are very, very strong anti-inflammatory. So people have to understand that steroid is not the treatment for the arthritis.
It's not the treatment. It relieves the symptoms.
It is mainly a symptomatic relief. I will not suggest steroid injection in either hip or knee or shoulder if I am not planning to do an operation for that. So let's take it that way, Akram. So if I suggest you to take oral antibiotics, oral NSAIDs, non-steroidal.
So it's an example, it's like ibuprofen.
So ibuprofen is an anti-inflammatory, and so is the steroid as well. So steroid is a very strong anti-inflammatory reaction. So what we are doing sometimes, if the patient comes with a severe symptoms and we think that those patients need hip or knee replacement in a 6 months to a year's time, but the patients are not ready because of some reason, then we will advise that they will have intra-articular steroid injection that will relieve their symptoms temporarily, so that when we can go back in after 3 to 6 months and do a joint replacement surgery. But steroid injection should not be replaced as an alternative to joint replacement. Sometimes, because after 3 injections, they stop working.
They stop working.
So if you have any steroid injection 3 times after 3 months apart, then they will stop working and they can cause more damage to the joint rather than any benefit. And especially when we are in this COVID situation, the steroids, intra-articular steroids, they are not recommended these days because they can suppress your immune system. So the dose with what we inject, is recommended to be injected low, and we have to really identify the patients who are not at high risk of COVID.
Farid, we talked about exercise, we talked about diet, and then we talked about a few medications like paracetamol and ibuprofen, like non-steroidals, and we talked a little bit about steroids. Are there anything else apart from surgery? We're going to surgery last option. Are there anything else we could do?
That's true, Akram. So there is a recent evidence of injecting.
1 second, Farid. There's a caller coming as well. Sorry, I'm going to hold you here. Let's get this caller join us. Hello. Wa alaikum assalam. Hello. What's your name, please? Okay. Thank you for calling us. Do you like to say what you would like to say?
Okay, I'm waiting.
Hello, yes? Do you have a question?
Can I talk to Bengali?
You can ask in Bengali and the studio will translate for us. That should be fine.
জি আমি ওয়েস্টার্ন যে আমার আর্থ্রাইটিস আছে কি তে আমার
Keep talking. Yeah, we're listening. Okay, you can while we doing the program, you can talk to the studio, and they will come back to me with the question in English, and we'll translate. We'll let you know the answers. Farid, please. Sorry for the interruption. Can you go ahead?
Yeah. So as far as your question, that is there any other alternative?
Alternative, yeah, that's right. Yeah.
Yes, we do have. There is a recent evidence of something called PRP. I'm sure you have heard about it. It's called platelet-rich plasma injections. Now,
platelet-rich plasma. That's right. Yeah.
Yeah. So what it is that the platelets have the some factors in it. Those factors are responsible for cartilage regrowth.
So you're talking about you have to take blood from someone.
Yes.
And from that blood you have to extract this particulates called platelets.
Yes.
And you inject them, isn't it?
Yeah.
Because I think in the bloods, let's explain a little bit for it. When you take the blood, there's a lot of red blood cells, there are lots of white blood cells, and there's platelets, isn't it?
Yes. So you concentrate, you put in a centrifuge machine, and that will concentrate different cells based upon their molecular weight, and you will get the platelet-rich plasma. Plasma is a part of the blood, so the cells are separate, and the plasma which has platelets in it, they are separate. So depending upon the concentration of the platelets within those plasma, there is a growing evidence that actually those platelet-rich plasma injections, they can significantly improve patient symptoms, especially in early to moderate arthritis. In severe arthritis, there is no role and it's not recommended. But in those patients who are young and they are developing early to moderate changes in their knee, then yes, there is a growing evidence that those platelet-rich plasma can improve your symptoms, and in certain individuals, they can actually help in regrowth of the cartilage. But provided all the other risk factors are not there, like obesity, like all these post-traumatic things as well. So if the patients are otherwise fit and healthy, and they have a minor to moderate arthritis, then yes, they will get benefit from PRP.
Farid, I have get the question translated as well. The lady was trying to ask that she has done an MRI. Apparently, they didn't translate what joint it is, but they found some changes of arthritis, and she wanted to know what she has to do at this point. It's a very difficult question, I know, because we need to ask more questions. But what can we say at this point?
No, so as you said, so the MRI is, if the arthritis has been picked up on MRI scan, it means that it's a minor changes, because otherwise, no one will suggest to have the MRI scan. If it is visible on X-rays, then we will normally not recommend MRI scan. So if someone has picked up minor changes to the cartilage on MRI scan, it means it's very early onset arthritis. So I will not worry too much about it. But what we need to do is we need to adopt our healthy lifestyle, which means non-weight bearing exercises, try to reduce the weight, keep it under control, healthy diet, reduce your fat content within the diet. If you do all those things, then yes, you probably will prevent the changes, further deterioration in your cartilage, and hopefully that cartilage will degenerate.
That's a great advice, Farid. I think our caller understands what Farid said. It's all about what we talked from the beginning. It's about the diet. It's about your exercise and reducing your weight. And maybe you talked about the cycling or swimming. She could take one of them. And if she still doesn't get relief with this, probably she can go to the GP and get more advice. Farid, we got only 3 or 4 minutes left. Can you quickly talk about the surgery? Because we're not going to talk too much about the surgery. We have a special program to talk about hip replacement, knee replacement, which will be in a few weeks coming back.
Yes.
So until then, can you say a little bit about hip replacement?
Yes, so the surgical option what we have is whether to go for hip resurfacing or a hip replacement surgery. I have to say, Akram, the hip replacement surgery, if you have a knee replacement surgery, they are the most effective treatment so far for the arthritis. If you come to that stage that your symptoms are bad enough, then I would suggest that you should go for a hip or knee replacement surgery. They are literally life-changing surgeries. You will, especially the hip replacement, is very, very rewarding operation. Patient will completely get rid of your symptoms of groin pain, anterior thigh pain, and you will get a lot of thank you letters and cards after hip surgery. The knee replacement, again, about 90% of the patients are very happy patients. They get rid of your symptoms completely. But knee replacement is not as successful as the hip replacement. About 10% of the people are unhappy, though you do all the right thing, but sometimes the symptoms did not get any better. And that may be something to do with the generalized body metabolic response to the arthritis. So yes, both hip or knee replacement are very, very successful operations. If you come to that stage that you cannot get rid of your symptoms irrespective of all what you have done, then yes, I would recommend hip or knee replacement surgery, and you will be very happy after that.
Farid, I know that I have worked with you for a few years. I know you very well, and you're one of the great surgeons. I know great success with your surgeries, hips and knees, and we have done so much, isn't it? So I know if you advise, the advice is good. Farid, it was a great talk. Before I forget, I want to remind our viewers that next week we are going to talk about something special. This is especially for ladies. We're going to talk about urinary incontinence. This is a condition, lots of people have it, and they can't get help because either they are ashamed or they don't want to go and tell about this problem. So we have a specialist who specializes on it. It's a gynecologist. He treats this kind of people all the time. So we're going to have the program. If you would like to call, you can call us, or you can write to us, or if you want to be anonymous, you can call us. You don't have to tell your name or something, and you can say a different person's name, and you can ask the questions. You might get more advice from that program as well. Farid, it was a great program today. Unfortunately, we don't have much time left, and amazing. So what can I say? Thank you for being with us. And have a great time in the pool and Bournemouth. Enjoy the sun, man.
Thank you a lot.
Okay. So be with us for a few seconds. And today we talked about arthritis, which is a condition which affects lots of people. According to Farid, it's a 60% of the population will get arthritis. So it's, if 2 of us here, 1 of you will get arthritis. So it is a condition, but it can be preventable. And the treatment, we talked a little bit about it, but we talked about the diet, exercise, and losing weight. These are the important things. Please watch our program. If you didn't understand, go back and watch again, or you can always write to us, call us, or you can tweet us, and we will come back to you with more details. So thank you for staying with us on Iron's Health Talk with Dr. Akram. If you have any further questions, please email us, Iron's Health Talk with Dr. Akram, on our Twitter or email address, which I have given already, and you got the number. You can always call us. So until we see you next time, look after yourselves. Thank you.